10 deadly bacteria for humans. Legionella pneumophila, Latin, is a gram-negative, motile, rod-shaped bacterium of the genus Legionella, the causative agent of legionellosis, Legionnaire's disease. Received its name due to an outbreak of the disease in 1976 among delegates to the Convention of the American Legion in a hotel located in Philadelphia. The causative agent is assigned to pathogenicity group 3. Until 2013 it belonged to pathogenicity group 2, i.e. to the group of pathogens of especially dangerous infectious diseases. Legionella pneumophila is pathogenic for humans, causes legionellosis, a sapronous bacterial infection in humans. The transmission mechanism is aspiration. The source of infection is household water heaters, air conditioning systems. An infected person does not have contagiousness. Helicobacter pylori, Latin spiral bacterium that lives in the pylorus, traditional transcription, X, G. Helicobacter pylori, is a spiral gram-negative bacterium that infects various areas of the stomach and duodenum. Many cases of gastric and duodenal ulcers, gastritis, duodenitis, gastric cancer, and possibly some cases of gastric lymphomas are etiologically associated with Helicobacter pylori infection. However, the majority, up to 90%, of infected carriers of Helicobacter pylori do not show any symptoms of the disease. The spiral shape of the bacterium, from which the generic name Helicobacter is derived, is believed to determine the ability of this microorganism to penetrate the mucous membrane of the stomach and duodenum and facilitate the movement of the bacterium in the mucus gel that covers the gastric mucosa. Bacillus anthracis, Lat. Anthrax, is a species of gram-positive spore-forming bacteria. The causative agent of anthrax. The first proven human pathogen was isolated into pure culture by Koch in 1877. Main article, Anthrax. B. Anthracis is the causative agent of anthrax, classified as pathogenicity group 2. Pathogenic factors include formation of a capsule with antiphagocytic activity and adhesive properties, the formation of a thermolabile 3-component exotoxin, consisting of 3 components, an edematous component, causes inflammation, swelling, a protective antigen, does not have toxicity, and a lethal component. The transmission mechanism of the pathogen is contact from fallen and sick livestock, infected with spores of bacteria in the soil. The formation of spores outside a living organism. The bacterium Bacillus anthracis can persist as spores without showing itself in any way, almost indefinitely, until the moment it is inhaled, swallowed, or comes into contact with an open wound, after which it becomes activated and causes deadly anthrax. Vibrio cholerae, Lat. Vibrio cholerae, is a type of gram-negative facultative anaerobic motile bacteria of the genus Vibrio. It was discovered by Filippo Pacini in 1854, which was ignored by physicians due to the prevalence among Italian scientists of the theory of infection with cholera by miasma through the air, and named by him Filippo Pacini Bacillum. Vibrio was rediscovered and independently discovered by Robert Koch in 1883. Vibrio cholerae secretes an exotoxin consisting of 2 domains. The domain responsible for binding to human epitheliocytes is the 12K subunit B pentamer. The domain that carries out ADP ribosylation of the Ga alpha subunit consists of subunit A. The action of the toxin is manifested in the activation of the G's alpha subunit of the heterotrimeric protein G, causing hyperproduction of CAMP, which leads to the release of ions and water from the intestinal epitheliocytes, causing diarrhea and dehydration of the body. Clostridium, Lat. Clostridium is a genus of gram-positive, obligate anaerobic bacteria capable of producing endospores. Clostridia are part of the normal flora of the gastrointestinal tract and female genital tract. Sometimes they are found in the oral cavity and on the skin. Bacteria of the genus Clostridium produce the most powerful known poisons: botulinum toxin, C. botulinum, tetanospasmin, C. tetany, epsilon toxin, C. perfringens, etc. All these toxins are of a protein nature. The genus includes both free-living species, e.g. Clostridium pasteurianum, and pathogenic species such as tetanus, gas gangrene and botulism. Clostridium chauvii is the causative agent of emphysematous carbuncle in livestock. Meningococcus, Lat. Neisseria meningitis, is a species of gram-negative diplococci of the genus Neisseria. Cause meningococcal infection, which can occur with damage to the mucous membrane of the nasopharynx, nasopharyngitis, meningitis, septicemia. Bacteriocarrier is widespread. The natural reservoir of meningococcus is the human nasopharynx. The route of transmission is airborne. The most common source of infection are carriers and patients with nasopharyngitis. Meningococcal infection is an acute human infectious disease caused by Neisseria meningitis, which is transmitted by airborne droplets and is characterized by a local lesion of the mucous membrane of the nasopharynx, followed by generalization in the form of meningococcal septicemia, meningococemia, and inflammation of the meninges, meningococcal meningitis. Epidemic cerebrospinal meningitis begins suddenly, after a 5 to 7 day incubation period. At the onset of the disease, severe headache, vomiting, high fever are noted, then meningeal symptoms develop. Salmonella, Lot. Salmonella is a genus of non-spore-bearing bacteria that have the shape of sticks, length 1 to 7 microns, width about 0.3 to 0.7 microns. The genus is named after American veterinarian Daniel Elmer Salmon, 1850 to 1914. Salmonella generally do not ferment lactose and are pathogenic to humans and other animals when administered orally. Some species are causative agents of typhoid, paratyphoid and other salmonellosis. Salmonella ferments carbohydrates, glucose, mannose, xylose, dextrin, and alcohols, inositol, dulcitol, with the formation of acid and sometimes gas. Optimum for growth are temperature 37 degrees Celsius, pH 7.2 to 7.4. They are unpretentious and grow on simple nutrient media. Salmonella can persist for a long time in the environment and food. UV radiation and heat hasten their death. They die when heated to 55 degrees Celsius, 131 degrees Fahrenheit, in an hour and a half or to 60 degrees Celsius, 140 degrees Fahrenheit, in 12 minutes. Reheating food at 75 degrees Celsius, 167 degrees Fahrenheit, for at least 10 minutes is recommended to protect against salmonella contamination. Salmonella does not die when frozen. Staphylococcus aureus, Lot. Staphylococcus aureus is a type of spherical gram-positive bacteria from the genus Staphylococcus. Approximately 25 to 40% of the population are permanent carriers of this bacterium, which can persist on the skin and mucous membranes of the upper respiratory tract. Staphylococcus aureus can cause a wide range of illnesses, from mild skin infections, acne, impetigo, can also be caused by Streptococcus pyogenes, furuncle, phlegmon, carbuncle, staphylococcal scalded skin syndrome, ANG, and abscess, to deadly diseases, pneumonia, meningitis, osteomyelitis, endocarditis, toxic shock and sepsis. Diseases range from skin, soft tissue, respiratory, bone, joint and endovascular to wound infections. It is still one of the 4 most common causes of nosocomial infections, often causing postoperative wound infections. Pneumococcus, Lot. Streptococcus pneumoniae is a species of bacteria from the genus Streptococcus, a motionless lanceolate diplococcus 0.5 to 1.25 microns long. In Russian literature, it is also known as Weichselbaum's diplococcus and Frankel's diplococcus. Streptococcus pneumoniae are gram-positive, catalase and oxidase-negative bacteria, which are facultative anaerobes, the growth of which increases with an increase in the carbon dioxide content in the incubation atmosphere to 5 to 7%. Pneumococci are one of the main causative agents of meningitis, otitis media, sinusitis, community-acquired pneumonia in children and adults. In more rare cases, pneumococcus can cause infections of other localization, endocarditis, septic arthritis, primary peritonitis, cellulitis, etc. In recent years, the problem of pneumococcal resistance to antimicrobial drugs has become increasingly important. An increase in S. pneumoniae resistance has been noted in many countries. Mycobacterium tuberculosis, Lot. Koch's Bacillus, MBT, BK, is a species of Mycobacteria, the type species of the Mycobacteriaceae family, isolated on March 24, 1882 by Robert Koch. Form: slightly curved or straight stick 1 to 10 microns in diameter, 0.2 to 0.6 microns. Cells with a characteristic property of acid and alcohol resistant, at one of the stages of growth, coloration are aerophiles and mesophiles, temperature range 37 to 42 degrees Celsius. However, in the course of life under adverse conditions, metabolism can change, and cells transform into microaerophiles and even become anaerobes. In terms of oxygen consumption and the development of oxidase systems, Mycobacteria are similar to true fungi. To date, it is believed that Mycobacterium tuberculosis, which are in dried sputum, remain viable when the latter is openly boiled within 25 minutes. Mycobacteria are sensitive to products containing chlorine, bleach, chloramine, etc., and tertiary amines, as well as to hydrogen peroxide. In a 20% bleach solution, the MBT culture dies within 3 to 5 hours.